honored that you are choosing to spend a little bit of your lunchtime today with us. It's a beautiful day and you might rather be outside, but we think we've got some good information to share with you today about Cape Fear Valley's medical residency program. As we get started, I want to ask all of our attendees that if you have questions, we encourage you to pop those in the chat, and we will make sure that those questions are addressed as we move through our presentation today. We have some great guests with us today on our panel, and they're going to bring all kinds of exciting information to you. We're going to hear a little bit about what's going on at Cape Fear Valley Health from a high level, some of the construction projects and other things that are going on. We're going to learn what's going on with our medical residency program, and then we're going to drill down to our emergency medicine program in particular and learn about why one resident in particular has made a decision to stay and practice medicine here in Fayetteville and Cumberland County. So I encourage you once again to just share any thoughts or questions you have as we go through this afternoon's presentation. First off, I want to introduce Mr. Mike Nagowski. He is the CEO of Cape Fear Valley Health, and we are very honored that he is spending a little bit of his lunch hour with us today to share with you all what's going on at Cape Fear Valley Health. So Mr. Nagowski, welcome.
Thank you, Sabrina. Thank you so much for having me be a part of this. As you know, I'm excited about talking about all the things that are going on at Cape Fear Valley. It's sometimes hard to decide where to start and where to go. But I think Jamie has a set of PowerPoints, and if she's ready to get us started on that, we'll begin the presentation.
I am ready, Mike. Can you see our slides?
I cannot.
Jamie, we see the opening slide, but not the presentation.
There we go.
Perfect.
Yeah, that's great, Jamie. Whatever you did, that's working. And so if you don't mind moving to the next slide. So, you know, here at the health system, it's been really enjoyable to see the health system continue to grow and develop and expand to really meet the community's needs. And so I'm going to talk about some of the items that we're working on at a high level, and then obviously a lot of the conversation will turn to the physician residencies. So Jamie, next slide, please. So this is one of the more exciting developments that we've been a part of in quite a while. Many people know about Harnett County, and you may or may not know that Harnett County has a very robust healthcare system. It's comprised of 2 hospitals. The hospital that's been around for more than 50 years is located in the city of Dunn, right off the 95. And then in about 7-8 years ago, they opened the newest hospital in North Carolina. It's located in the center of Harnett, and it's creatively called Central Harnett Hospital. It's in the seat of county government in Lillington. In addition to those 2 hospitals, they have a number of outpatient sites, 7 primary care offices and 8 specialty care offices, ranging from general surgery to oncology, soon to be ENT, orthopedics. And we're really glad that Harnett Health has decided to join the Cape Fear Valley family. Many of you may know that since the end of 2014, we've been up there really in a management function. And this past year, the board and the community of Harnett County decided that instead of just being in a relationship that revolved around management, they wanted to be completely integrated and have joined the Cape Fear Valley team. So we're really proud of the work up there, and we're really grateful that they decided to become part of Cape Fear Valley. So all of Harnett Health's facilities are now part of the Cape Fear Valley family. And Sabrina, if people have questions, whatever the technique is fine for me. If people want to ask me questions during these slides or at the end, happy to answer any of them. But if
okay,
Jamie,
we'll be watching the chat for those questions. Thank you.
Thank you. So Jamie, next slide, please. You know, here at Cape Fear Valley's Medical Center, it's one of the busier facilities you're going to find in the entire state. And it certainly is the busiest emergency department in the state, one of the busiest emergency departments in the nation. One of the issues that we face is continuing to grow to meet the needs of patients who come to the emergency department and eventually need to be admitted. And over the years, we've added a lot to the campus. We've built an additional campus in Hope County to accommodate the ever-growing volume. At the end of this calendar year, we are expecting to open the newest medical unit in the health system. It's going to be located on a location within the health system we're calling 4 North, and it is an area of the hospital that we have reclaimed. It was pretty much just administrative space. So we've gone in and really torn it down to the studs and rebuilt it. So 20 new beds will open up within the medical center here at the end of the calendar year. All big, brand new facility type of patient care rooms. And so we're excited that that growth has continued. And next slide, Jamie. So, I like to talk about our new adolescent unit in terms of the construction projects that we have going on here at Cape Fear Valley. Most people, when they see the hospital, they can see to the right of the hospital, if you're on Owen Drive, a significant facility that we're going to talk about here in a little bit. But I often like to say that perhaps one of the most important construction projects we have going on the campus isn't really visible from either Village or Owen. It's in the back of the campus. It is the state's newest adolescent unit for behavioral health services. It is a much needed service. It is a brand new facility that's going up really adjacent to the behavioral health hospital. It will, when it's completed, will have the ability to house 16 adolescents who are here for behavioral health issues. And what's so great about this new unit, it is so sorely needed. People who need to have inpatient care, our adolescent population in today's environment, really don't have a lot of fabulous options. Often here in Cumberland County, they have very extended stays in our pediatric emergency department. And it's not uncommon for people to have to stay in the pediatric emergency department for weeks, seeking the right services until a bed will open up somewhere else in the state. And that somewhere else can often be a multi-hour drive. So we're really glad that this effort is coming to fruition here. I have to say special thanks to the emergency department teams for all of their emphasis on getting this done. But I really have to thank the psychiatry department. It was really Dr. Ken Fleischman's, Dr. Klenzak, Dr. Sam Fleischman's vision that our population of adolescents shouldn't have to travel out of the county to receive these kinds of services. So again, brand new set of services that will open up here in Cumberland County. Really glad that we're going to be able to provide these services here locally. And when it's all said and done, it will be able to house up to 16 patients. Next slide, please. So I had just referenced this facility. This is the architectural drawing of what this facility will look like. Again, if you're looking at the main campus and you look to the right, it's impossible to miss the construction project going on. This is the Center for Graduate Medical Education. It will also house the Neuroscience Institute. The first 4 floors of this facility are all geared towards our physician residency program. And then the 5th floor is where the neurosurgeons, neurologists will be located. It is a sorely needed facility. We're incredibly proud of the physician residency programs that have come out of the ground. But the one thing that we've been lacking is the adequate space. You know, when the medical center was originally built, it wasn't built with the vision of being a academic medical center, of a major teaching hospital. So we don't often have all of the optimal teaching facilities. The residents don't have all of the proper space that they should come to expect as these programs have developed. Simulation is now such a big part of our training programs. And while we're really proud of our simulation equipment and our space today, wait till you see what will be in this new building. Just some of the generalities of the building. It is 5 stories. It's about 120,000 square feet. It'll contain all the modern teaching technologies that people are coming to expect. Interestingly, though, the floor plates in this facility are so tall that even though it's only 5 stories, it will be almost the same height as the 8-story component of the medical center. So it'll be a very prominent, easily visible center. It will be not physically attached, but very, very close with a covered walkway between the medical center and the Center for Medical Education. The main conference room will be able to house more than 500 individuals, and we'll be able to beam in lectures from other facilities as appropriate. It will also house food options for the center, for patients, for visitors. We're anticipating a Chick-fil-A and a Panera Bread to be opening on the first floor of that facility. We're really grateful for all of the work that the foundation has done to bring this to fruition. And we expect to open this facility in summer of 2022. So a lot of excitement around this, and we're looking forward to it opening. It has been a long time coming for the Neuroscience Institute. You know, our neurosurgery teams and our neurology teams have world-class skills, but we have not had a facility that matches their skills. So the 5th floor of this facility is where their physician offices, patients will come to see them on that 5th floor. So equally as exciting to all the other construction projects is the Neuroscience Institute. Looking forward to getting this up and off the ground. And Jamie, do I have another slide? Yeah. So this is another brand new component. You know, the health system for a number of years has been involved in different types of research, and we've conducted clinical trials here, especially in the oncology world, for the last decade. But as the physician residencies really took hold, as conversations about growing our academic medical center status came to fruition, it was pretty clear that the ability to conduct more types of research was important for us. And so the Carolina Institute for Clinical Research was stood up in late 2018. We did our very first clinical trial out of CICR in the end of 2018. And as you can tell, here through 2021, I actually think by the end of the calendar year, we'll eclipse 40 clinical trials. People often ask me, Mike, what kinds of trials do you work in? And well, while we're open to a wide array of clinical trials, we really feel like we've got expertise in the COVID trials, women's health and related clinical trials. We do a lot of clinical trials in oncology and in diabetes and nutrition. So just wanted to point that out. That institute is actually housed out of a facility that we own on Purdue. And it continues to grow. Really proud of the work that's being conducted there. And Jamie, that may be my final slide. Is that correct? Yeah. Well, and I think with this, is Dr. Maharty going to walk us through this?
Yes.
Yeah. So let me just spend a little bit of time introducing Dr. Maharty. You know, the residency programs here have just been an incredible addition to the health system. The energy that the residents bring, both in terms of just the raw energy and the enthusiasm that the faculty have, all of that, I have to give credit to Dr. Don Maharty. Don, in his vice president role, has really been the architect and the creator of this infrastructure. So with that, I'm going to turn this over to Dr. Maharty.
Well, thank you for those kind words, sir. I appreciate it. Good afternoon, everyone. It's a pleasure to be here, an honor to be able to tell you what's been going on behind the scenes. I'm going to give an overview of the residency, and I was asked to give a brief history. And I believe the whole dream started with our board of trustees and Mr. Nagowski having the vision to bring residents here to fulfill several needs. One was just having physicians for the healthcare in our valley and a good supply, and then a dream with Campbell as they started their medical school. I believe it started in 2010, and I came on in 2015 to help implement those dreams, and we started our residency programs in 2017. Jamie, if you want to go to the next slide. And here's what we have. So we started with 5 residencies and 32 residents, just the first year class. And now it's mushroomed into a fairly large number. We have 214 approved residency slots in 9 residencies. And currently we have 171 residents. And these are all the residents that we have. Our latest one on was the cardiology fellowship, which we started last year, and we currently have 6 residents in that. Our internal medicine program is approved for 60 residents. We currently have 51. Emergency medicine is approved for 44. They have about 34 right now. They are the second largest in the entire state, and that's pretty neat. The largest one is 45. They increased the year we brought on 45. And then we have a transitional year, which is a year where we have a rotating internship where they still visit certain specialties. They wait to go on to more specialized residencies or compete again for a very competitive spot in some of our residencies around the country or here. General surgery has 15. That program is now looking to have 20. Obstetrics and gynecology has 16. Psychiatry has approval for 32, which is new, which we're really excited about. And then finally, pharmacy and podiatry, 9, and we have 12 podiatry approvals. So our total number again is 214 approved spots. We have about 171 in the system, and we're currently building out. I'm happy to say, as of September, all of our actually 6 initial residencies achieved the highest accreditation you can have and are accredited for the next 10 years, which is a great feat by a lot of our program directors who've worked so hard, and all the administrative staff and the hospital itself, just supporting such an effort, an academic effort for the community. So you may ask, well, what's the future hold? Next slide, please. Our next slide is exciting because, as Mr. Nagowski, he talked about the child and adolescent, the adolescent unit that we're going to have. We're bringing on at the same time a child and adolescent psychiatry fellowship. We're waiting on final approval with the application. The applications for all these programs, they take about 1 to 2 years to put together, build the teams, recruit, and move forward. And we hope to have actually approval for up to 6 to 8. We'll start with 2 fellows each year and build as we can, and move that program forward. We also have an exciting program. It says 10, but it's actually 20 now, orthopedic residency spots, and that's a combined effort with Womack Army Medical Center. We're one of the few programs that will interface with the federal government and work with the military to help fulfill the orthopedic residency program requirements and help the military in their mission with orthopedics. And we're very excited about that. We're actively recruiting, and we have numbers down here. You never know where they're going to turn out, but we're actively recruiting for all of these other ones: pulmonary, interviewing, critical care, absolutely needed to open up, and all the other ones that you see on there. And again, if there's any questions, please don't hesitate to stop me. Can you move on to the next slide, please, Jamie? So what's the future in the next 10 years? I gave you a little glimpse there, but we actually put it on a more busy slide. Next slide. We're really looking to expand to 302 residency and fellowship spots here. And if you include Harnett has another 49 residents in their health system. We'll be over 350 residents for our entire Cape Fear Valley health system, and we're very proud of that. Harnett Health has recently become part of our health system, and they have 3 residencies up there: family medicine, internal medicine, and a transitional year, and they're doing a wonderful job. But you can see all of the other plans as we move forward. We say by 2028, so we'll see how that goes. 17 residencies, plus Harnett will be 20. All right, next slide. I think Nagowski did a wonderful job covering this. We're looking forward to the Chick-fil-A and the Panera Bread and everything else that goes on into the medical education. I will say one further just comment. Having a 500-person room with the latest technology to get all of our staff together to do educational events will be game-changing, I think, for the academic environment. We love it. Our rooms now, where we use some of the auditoriums, are about 150. We can't even get all the residents together in person. And there's an energy created when you bring in scholars from all across the world, or even here, and get everybody on the same page moving forward. So we're very, very excited about that. Next slide, please. So you may ask, well, what happened here? Now it's 2021. You started in 2017. What happened? Did you fulfill your mission? And we're excited to say that over 50% of our residents that have graduated, were eligible to graduate. We've graduated way more residents than this, but some of them were transitional years moving on, and many of them went into fellowships. But of the 30 total, 15 have chosen to stay back here. And this year we have many more that hopefully I'll get to announce next time we put this together, have signed contracts. Of those, we have 2 of our 3 OBGYN first class stayed in the area, and one employed by Cape Fear, one employed by a private practice that works in Cape Fear. 5 of the 7 emergency medicine residents chose to stay at Cape Fear, and 8 of the 21 internal medicine residents. And then 6 went on to do fellowships across the nation in nephrology, cardiology, palliative care, and critical care. So we're really excited about this. Next slide. And when we looked at the national averages, we're a little bit ahead of that, with probably about 70% of our eligible residents to stay back have stayed at Cape Fear Valley and chose to make their home and to practice here for many years, and we're excited about that. Next slide. And so an overall summary of all that's happened. Basically, we've grown from 0 programs to 9 programs at Cape Fear Valley proper, with 3 more up at Harnett Health that we were involved in helping out. We're waiting orthopedics and child and adolescent psychiatry starting in 2022. We've expanded our psychiatry residencies to 32. Our programs are all accredited, that we're able to sit for accreditation. Basically, they have to be around 2 years. And we've expanded, we're looking at expanding our surgery to 20. That's new since I put these slides together just a month ago. And then our growth in residents continues. We're at 171. We'll be at 214 shortly, and then hopefully at around 250. And the total system will be around 350. And then we've had a high retention rate, and we're trying to address the physician shortages in our area, which will help the healthcare in general take it higher. We've had 6 to 8 of our residents go into these rural areas. They'll be rotating out of Bladen in those underserved counties and rural counties, and here at Cape Fear Valley. Thank you very much.
Thank you, Dr. Maharty, and thank you, Mr. Nagowski, for that information about what's going on at Cape Fear Valley and some specifics about the growth of the residency program. At this time, we're really excited to introduce to you a couple of people who have their boots on the ground, if you will, in terms of delivering care to this community and growing this residency program. Dr. Tony Grello is the Associate Program Director for Emergency Medicine, the Emergency Medicine Residency Program here at Cape Fear Valley Health, and is an emergency room physician as well. And Dr. Julie Puzzo is one of the medical residents. She is in the class of 2022 and will be finishing up in this coming summer. So we're going to hear a little bit about their experience, and then I'm going to also ask Dr. Matt Walker to chime in after we learn a little bit about the emergency medicine program. Dr. Walker graduated this past summer in our OBGYN medical residency program, and he and his family have made the decision to stay in Fayetteville, and he's a member of our medical staff. So we're really excited to hear his experience as well. But Dr. Grello, would you start us off by telling us a little bit about the emergency medicine residency program and what it means to have that in one of the busiest emergency departments in the country?
Absolutely. Thanks again for having me. It's great to be part of this. So the program itself is a 4-year program where residents work alongside our core and teaching faculty, both in and out of the department. We have weekly educational conferences and simulation sessions to fortify their hospital experience. During the first year, half the residents' time is spent in the emergency department, and the other half is spent with other specialties like general surgery, OB-Gynecology, cardiology, working together with those other teams in the hospital, getting to know them and gaining firsthand knowledge of those areas, bringing those relationships and expertise back into our department and integrating that into their EM practice. The second year of the program, we consider their emergency medicine immersion year. And most of their time is spent in the emergency department. That year is a year of exponential growth. We see our residents really start to shine and as their practice develops. By the third year, they really have a strong skill set. In addition to spending time in the emergency department, they spend a considerable amount of time in critical services such as trauma and adult and pediatric intensive care, both expanding their knowledge base and lending their expertise to these critical areas, really helping out with patient care. In the final year, they start to act as junior attendings. Like the other years, they're still under the supervision of a teaching physician. However, they take on a bigger role of the overall functioning of the department and instructing our younger residents as they put that final edge on their training. And as mentioned earlier, we started in 2017 with 7 residents and currently have 35. In the next few years, we'll grow to our target number of 44 or 11 per year. We graduated our first class last year, and again, proudly, 4 out of 7 of them have stayed around, working with us in our department as we speak. And it's great to see. I started out in the system. I got here in 2005. I eventually got involved in emergency administration as the associate medical director for performance improvement, and couldn't retain and attract people to the area all that much. And so when they asked me to get involved, I was so excited. I was like, absolutely, why not train and retain our own? So again, that vision from leadership to bring the residencies has really made such a difference. And it's been great to see our mission to train and retain, and now, recruit and retain those residents to our area. It's been great over the last several years.
Thank you, Dr. Grello. Dr. Puzzo, would you tell us a little bit about your experience on the front lines of this residency program? And I should note that you are one of our chief residents in the emergency medicine program.
Yeah, hey, I can't say enough about our program, about how amazing I think our program is. I love working at this hospital. I think that everyone talks about how busy we are, and for an emergency physician, that's great. Like, I'm learning how to see large volumes of patients, really sick patients. We are a trauma center, which is amazing for our education. We've got really great faculty within the department, but I also think we have an amazing relationship with our specialists, particularly our intensivists and our surgeons, our OB folks. Like, we just, I think that I just, like I said, I can't say enough about the program. I feel like I'm getting such an amazing education. And I truly feel that whichever setting I end up in, whether it's an ivory tower tertiary care center or a standalone ED or something really rural, I think that I will be very well prepared to handle anything that comes next.
Thank you. Can the two of you talk about how our simulation lab impacts what you do in the emergency department?
Want me to take that a little bit, Grello?
Certainly, yeah. Again, when I was in training, the adage was see one, do one, teach one, and that all happened on a real patient. Now, in our simulation, we can see 10, sim 10, and teach 10 before the patient even comes into that equation. You can take a resident who may need some work on dexterity on a certain procedure, and you can practice that in a supervised environment on a simulated mannequin. I remember putting central lines or big IVs into pillows in the call room. This has certainly come a long way. These mannequins are so lifelike. It really gives you the opportunity to practice. And, whether you're a sports addict or a musician or anything really that takes a skill, you practice how you play, how you practice. And that's same goes for medicine. You really practice how you practice. And so, we like to practice together. Having our sim lab allows us to get together outside as a team and really take on some of those critical situations that you might not see all that often in the emergency department, but when you see them, they're impactful. The biggest problem we have right now is we have a one-room simulation center with some of the finest equipment you can ask for. It's been fantastic, the support we've gotten. But early on, when we had just 7 residents, we would get together with the trauma team when they were a small group, or we'd get together with the internal medicine team when they were a small group. Now we've grown so much, it's difficult to fit just our residents in a day. So having this new center and being able to get everybody there, and again, get those teams together that actually practice in the emergency department outside in a simulated environment, we can take these high stakes resuscitations and practice them with the same team that responds in real time. So it really does make a difference in patient care.
Thank you, Dr. Grello. Dr. Maharty, did you want to add to that?
I just want to say something. I mean, Dr. Grello has led our effort for the simulation team. He's our director of simulation. He's done such a great job. We have him helping all of the residencies out. He's revolutionized the way he teaches simulation medicine. He's also a good chef, so he likes to do food and simulation, and he has a brilliant idea that's going to be published and probably marketed across the country here. I mean, it's really exciting. And he teaches about ribs and then barbecues the ribs. He teaches about other things that I don't want to talk about. And he has the resident, right, Dr. Puzzo? Quite amazing. So great job.
Yeah, those are some of our most fun, obviously with COVID, it's just been challenging. We've had to adapt a lot of how we do some of our extracurricular type fun stuff, but Grello also has all this crazy equipment on the computer to record things. So he's been amazing about just doing the videos at home and getting it out to us so we still get the education, even if we can't obviously be in person. But yeah, those are some of the most fun, things that we do for sure.
And in the new building, we will go from one simulation room that we have currently in the medical center. In the graduate medical education building, we will have 4 separate simulation rooms that are set up to mimic an operating room, an emergency department room, a surgical suite. Excuse me, I said that. Help me out, Dr. Walker. What else are we going to have in there?
Critical care.
An OB
Critical
room.
care.
Yes, thank you, Dr. Maharty.
And then they'll be
So it's
teaching
going to
us
be a very much expanded simulation opportunity for our residents. I do want to pull in Dr. Walker now. As I mentioned earlier, he graduated and finished the OBGYN program in June of this year and has joined Cape Fear Valley OBGYN Clinic and has chosen to stay here to practice medicine. Dr. Walker, we are so happy that you and your family are staying here in our community. Can you tell us a little bit about your experience and the decision to stay here and practice medicine?
Oh, absolutely. But first, I want to sort of piggyback on what the emergency medicine was saying. In terms of our experience and our training. So OB does have the most residents stay. I like to point that out, 2 of the 3. So 66%. But the one resident that did leave, she went to sort of on the border of West Virginia and Pennsylvania, and she's been there. She started in July, just like all brand new attendings. But it's only beginning in November, and everyone in the hospital is saying she's the best OB and the best surgeon in the entire hospital. So I think our name is being, talked about even as far as Pennsylvania, just how well of our training program that we have. So kudos to her for being so good, but also kudos to the program for being excellent. But yeah, the decision to stay in Fayetteville is a very easy one for me. My wife and I, we love this town. She's active duty at Fort Bragg. We have 2 small kids, and we've definitely made a home here. And the Army sort of is thinking about moving Kelly, but they're being very nice to us. They're letting us stay because we like the area. She's doing so well there. We really enjoy working here. So it really was easy. We do enjoy Fayetteville a lot. We have tons of close friends, and this hospital is a great place to work. It's like great training environment, and also is helping me with my other career aspirations of, getting into GME and becoming more of a leader in the GME. So this is a very easy decision for me.
That's great. So, Dr. Walker and Dr. Puzzo, can you expand a little bit more about how the various residency programs do work together to enhance training in each of your particular areas?
I think one of my favorite parts of obviously we love being in the ED. I like being back home. We call it in the department for our rotations, but I really enjoyed our off-service rotations, just getting to build relationships with the internal medicine people, the surgeons, our OB folks. Every time that we get to we spend a month with them, sometimes a little bit more, but just, learning what they do, seeing what a day in their life is like. But the best advantage for that is the relationships that were made with those residents and with the attending, so that when I do come back in the department, I feel way more comfortable calling them on the phone, asking questions, learning stuff from them. And then especially with the residents, like a perfect example, I had a patient in the emergency department the other day that had a feeding tube in, and there was something weird about it. I wasn't feeling comfortable. I happened to glance out of the corner of my eye and see one of the surgery residents, and I just said, "Hey, can you just come look at this really quick?" So kind of one of those curbside consults really. And he was able to just pop in, help me troubleshoot something, and we moved along. The patient got exactly what he needed. And so I wouldn't have been able to do that or felt comfortable doing that had I not spent time with them on their rotation. So, and even with the attendings too, it's, you know, a lot of programs will talk about being intimidated as a resident to call the surgeon or the neurosurgeon or whatever. But I feel like with our ability to interact and spend time with each other and other specialties, that we don't really have, at least personally, I don't have that fear. I totally am comfortable asking for help, asking questions. You know, it's great. I think that's one of the biggest strengths with our program. I'm always learning from them and feel safe asking for help.
Yeah, that's same for OB resident. I'll speak for the current residents and, you know, me as a resident. That was definitely one of the huge benefits, is that you were able to curbside consult and you knew them, you were comfortable with them. No intimidation at all. Like, we're all here just for the patients, and we all know that. So yeah, and that's one of the huge perks of the GME building, is that we'll just have a larger place to practice medicine, really practice, you know, in terms of simulation and just collaboration. It's just going to be right there.
Because now I think most of these interactions are happening, like I said, when we're on, like that month when we're on their service. And then, you know, we see each other in the hospital a little bit. But I think having this building where we're all going to be milling about and spending a lot of our, you know, free time or downtime or whatever, it's going to facilitate those relationships and those conversations so much more. I think that's going to be amazing.
Oh yeah, I mean, just since, you know, OB and EM are on this chat, you know, just having combined didactics about, you know, obstetrical emergencies,
Yeah.
or, you know, something that would be just phenomenal for everybody. So.
And if I could jump in for a minute here, you know, a big
Please.
kudos to Dr. Maharty on that vision and really kind of press the importance of the new center. Dr. Maharty introduced many of us to this concept of unified graduate medical education. And you, like me, when I first heard it, probably asking what that means. Most programs have residents and leadership spread throughout their campus. So you'll have surgeons in one building, you'll have OB doctors in another, you'll have EM docs in another. And that builds up a silo effect. It's a mindset of where surgery, where OB, where EM, and we shouldn't mix. And here, we're Cape Fear. In addition to spending time with each other on services, which a lot of hospitals do. I mean, they all mix in the hospital. Our residents and leadership have a central location, a place where we work together to assure we come together as a team. And, you know, we participate in common activities, educational conferences, retreats, social events. And so when you know each other personally and professionally, it just helps to build a more collegial relationship inside the hospital as well as outside the hospital, and that pays major dividends. And right now we're just running out of space to do that. And so when this new building is here, we'll be able to get together more and have, like they were just saying, combined EM trauma rounds, combined EM OB rounds, where we can talk about interesting cases and learn from each other, and again get to know each other better. Because when we know each other better, you know, who benefits from that? Really, the patients we serve. So it's a great concept, very important one.
Yes. So Dr. Grello, piggybacking on that idea a little bit, can you speak to how you have seen the care of the community enhanced by having our residency program in place here in Cape Fear?
Absolutely. Again, being here since 2005, I've seen the evolution of Cape Fear from a community hospital to a healthcare system and now an academic center. And really, the difference is palpable. You can see it, you can feel it. It's so exciting to be part of it. Before the residents, you know, when a sick patient arrived, sometimes we needed multiple procedures, and you had an ED doc who was there performing them one at a time, picking which one was the most important, getting it done, moving on to the next. And while this was all going on, there were patients who were waiting to be seen. Now we have expanding team approaches where critical patients get these life-saving procedures all done at once. And it really takes advantage of that first golden hour of stabilization. We can do things more efficiently. If part of the team is at the bedside of a critical patient, the other part can be out taking care of other things in the department. And it just raises the care of everybody in the department. You know, same goes for specialty care. You know, there was a time when an on-call surgeon or their backup were in the OR, the next patient who needed care would have to wait for that specialist. You know, I remember the first time Dr. Walker came down to see an OB patient when the attending was up in the room doing a delivery, and you're just like, oh, thank you so much for coming down. And they can start to expedite that care and then get their attending physician informed and just continue to move the care of the patient along. So it's so much more efficient and effective. And again, having that teamwork just makes a difference in patient care and outcomes.
And
That's great.
I think there's like an air, obviously I haven't been here before there were residents, but there's just like this air or feeling like overall encompassing of learning. So there's an expectation of teaching and learning regardless of where you are and what specialty you're at, no matter who I call on the phone to admit or, ask for help. Like there's just this constant imparting of knowledge from the attendings, from resident to resident, and it's just permeable throughout the entire hospital, which I think is pretty cool. I think that's something that you don't necessarily have without residents. You kind of get stuck in your way of doing things. But now we're learning in conference, we're learning from each other. It's just no matter where you go, there's learning and teaching everywhere, which is really cool. That's how you become a better doctor, because medicine's always evolving too, right? Like there's always new things to learn. So having residents around sort of forces you to keep up on it and keep learning the new stuff.
That's great. And that certainly translates to the care that we provide our community. So thank you for that. Dr. Puzzo, can you speak to your plans after graduation? You're sort of in the last few months here. What are you thinking?
Yeah, I am. I know this is actually like not a sore topic. I don't know what the right word is to say, but it's a decision I'm really wrestling with, because I have like I said before, I love working at this hospital. I think especially for an emergency doc, this is sort of a dream, like a diamond in the rough hospital. We're so busy. We have really sick patients. We've got the trauma, but we're not necessarily an academic center where there's like a specialist for the specialist, so we in the ER get to see it all and do it all. And it's really an amazing place to learn. And so the desire to want to stay and continue doing that is really big. But then I've got also, I'm from California initially, and I've got my entire family out there. My husband and I are wanting to start our own family. So there's a big family pull. So we're looking at options in California, but I tell you what, it's really tempting to, there's a strong pull to stay here too. So no final decisions have been made yet. We're trying to figure it out.
Well, I'm sure there's plenty in Fayetteville that would be glad to serve as your surrogate family should you decide to stay. So, Dr. Walker, let's go back to your experience for a few minutes. You've talked about how important it's been for your family to stay here, but tell us a little bit about what it's been like to now be on your own as a physician in the community where you trained.
Yeah, so that's night and day, really. It's just so much different than residency, but it's also really nice being here as an attending when, I'm actually out at the beautiful Hook Hospital right now. So that's what I'm at the office now. I'm actually sitting in Dr. Schutzer's chair because he's on vacation. But it's so nice, having him right down the hall with me. So just in case I do have questions, I'm extremely comfortable asking, questions. And I don't feel that, I'm just left to my own devices, but also I am left to my own devices because I'm able to practice how I want, even though, Dr. Schutzer and I, we can disagree now because I am also the attending. But I always have someone to lean on. And the other thing that I've sort of found out the past couple weeks as being an attending is that, these patients, I'll see them out. I'll be like, oh, I know that person, when I was a resident, but now I see them, I was like, oh, hey, that's my patient. So it's a whole new aspect. And I sort of have I'm developing this whole, they're mine, like they're my patients kind of mentality, which I think is special. So I was not expecting that. So it hit me. So it's pretty neat.
That's great. That's great. I want to remind everyone who is joining us as an attendee that if you do have questions, please drop them in the chat. We'd be glad to address those. Let's take a minute. We've got just a few more minutes. I want to give everybody on the panel a chance to add anything that maybe I have not asked at this point that you want to share with our community about this program and why you've decided to be such an important part of it. So Dr. Grello, we'll start with you, please.
Well, again, like I said, getting in 2005 when I got here, it was a community hospital. To be part of the evolution and part of the vision that was put in place has just been a wonderful experience. I always tell people I came to Cape Fear in 2005 for a job, and then when I took on the the associate medical director, it became a career. But when they asked me to be part of the residency, it really became a calling, and it's just special to be part of it. And, if you look around us for a while, to the north, you could get great care. To the west, you could get great care. To the south, you get great care. And then there was this area that Cape Fear sat in, and there was the vision to deliver care to the people of our region. And now to see that vision become, reality and bring it through to fruition has been just a work of a lifetime. And to be able to work with the people who I've been, lucky enough to be part of, and have the residents, it becomes a family, and it's special. And I hope to spend a career here, and when sit back, say, look at what we've done. It's been great. And who's going to benefit from that? The patients and people of the region. So I couldn't ask for more.
That's great. Thank you very much. Dr. Maharty, what are your thoughts? Anything you would like to add?
Well, besides that, I'd like to just say thanks to the community embracing how they've just stepped up and helped. And the residents notice this. They notice when they're out at the gala, when they go to the houses that people invite them in. They're very grateful. We're very grateful. Without the partnership, we couldn't do the things that we're doing. A lot of the sim lab equipment, which is used here, you see other programs, it sits and it's dusty. We've got people doing it, and we're doing the simulation over and over. It is vitally important that we have that. Why am I here? Why did I come into this job? The dream of serving a noble cause to help other people and to multiply, to multiply the training and the production of physicians, rather than just being a physician and being in office. And I'm not putting that down, but the education piece of that, and to multiply the efforts to produce great physicians and then see more people taken care of. It's a dream to see that, and to see this area filled with people who are going to care for us and our families, that when they get older, to see those seeds harvested and to see the family develop that has occurred in the GME family. That's what we talk about. It's just been a great journey, and I'm so thankful to be here. So thankful to be in the community. We've been here for 25 years in Fayetteville, and it's been a dream. We came from Hawaii, and I always say it's just like Hawaii. Just there's no ocean. We've got the sand, but the people are beautiful here, and that's been our career. So.
That's wonderful. Thank you. Dr. Walker, would you like to add anything?
Just a heartfelt thank you. And, like Dr. Maharty said, we really were embraced by the community. All the residents have been and continue to be, and my family is one of them. So thank you so much for everything this community, the foundation, the hospital does for me and my family.
Good. Thank you. Dr. Puzzo, your ending thoughts?
I would, yes, similarly echoing that, just a huge thank you to this hospital, to the community. I think particularly during COVID, as we all know, this past couple of years have been really, really hard. But we've heard a lot of horror stories from other residency programs that were not supported. And I think that I never felt that a single time. I felt protected, I felt safe, and I felt supported by the hospital and by this community. And I'm very grateful for that. So thank you to everyone.
That's great. Thank you. And Mr. Nagowski, would you like to add anything to the conversation?
Well, just two points. One, Sabrina, thank you for your leadership. Under your leadership, the foundation has truly blossomed. We could not have accomplished the things that we've accomplished without the support of the foundation, which means the community is supporting us. The second point that's really important to note, a huge thank you to the type of individuals who became our residents here. The folks that are on the screen here and the folks that you don't get a chance to meet, they knew they weren't coming to residency programs that had been in establishment for the last 30 years, right? But I think that was probably part of the draw, because they were able to help shape the residency programs, right? And it takes a special person to want to be part of something that's going to be grown. So thank you to the residents that are here with us today. Thank you to all of the residents and the faculty that have created what we have now, which is a fabulous foundation to get to grow from. So Sabrina, thank you for having these sessions.
Thank you. I appreciate those kind words. It is because of the community that we've had the success that we've had thus far in terms of fundraising for the GME building and growing this program. And it certainly has been our honor to be able to share this with the greater community. I think it's making a difference in terms of the healthcare that we provide each and every day. So thank you to all the panelists for joining us and taking time out of what we know are very busy days for you all. And especially to the attendees and our guests today. Thank you for taking your lunchtime to learn more about the program. The foundation staff is here to answer any questions, help you learn more about the program. I know Jamie has provided some follow-up information and contact information for our team, and we would be happy to share any additional information with you. But it's been an honor having everyone here with us today, and we look forward to seeing you all again soon. And best wishes to our new residents, our soon-to-be graduating resident. Keep up the good work. Keep taking good care of this community. I hope everyone has a great afternoon, and we look forward to seeing you again soon. Goodbye now.
Thank you. Take care.
Thank you.
Thank you.